balloon sinus dilation has been around over 10 years. When the balloons first came out, we were almost exclusively using them in the operating room in conjunction with endoscopic sinus surgery because they were a very safe and effective way to open up certain sinuses that are more dangerous and could get more complicated, have patients have more complications. With that in mind, it was basically in 2011 that Medicare allowed for balloon sinus dilation to be done in the office, and that's when it really sort of exploded as a office-based procedure done under local anesthesia.
Great. Any last questions? I know she's here. So anything about pediatrics? No. Any other treatments? Any other?
Let's pull it for a sec real quick.
I mean, unless we wanted to talk more about other procedures, like, turbinate reductions or something like that.
That's a question that comes up. Why don't you tell us what is a turbinate reduction?
So a lot of people actually come in saying that they have a deviated septum, and were told by their doctor or another ENT doctor that they needed their septum corrected and they needed to go to the operating room. I see many of those patients on a daily basis. A lot of them don't even need their septum corrected. There are these turbinates on the outer wall of the nose. They're fleshy ridges on the outer wall, and frequently they get thickened. The mucous membranes and the tissues thicken up over time, and then patients feel obstructed. They can't breathe well through their nose. And so a lot of those people you could do a turbinate reduction on, where you take a shaver and you just remove some of that thickened tissue from those turbinates. It's done under local anesthesia. It's a simple office-based procedure. It takes about 15 or 20 minutes and provides long-term improvement in breathing so they can get off their medications.
One last question. Let's talk about recovery time. Give me real quick a recovery time for balloon, and then the second one, a recovery time on sinus surgery.
Okay. When I do balloon sinus dilation, typically my patients are sedated and they go home, and when the sedative wears off, they start to resume their regular activities. Usually by the next day, they have resumed their regular activities. With endoscopic sinus surgery, we're telling them usually about a week away from their regular activities. Now, it's not to say that people can't go back to work in a few days, but they tend to not be able to do a lot of strenuous activities for at least a week after those procedures. Second thing that I see is that in the postoperative recovery from balloon sinus dilation, there's really not anything. Excuse me, I gotta.
You can start again at the second thing I need to see.
Yeah. When you compare endoscopic sinus surgery versus balloon sinus dilation, one of the things to consider in the post-procedure period is the amount of discomfort that you might have, and that a lot of times has to do with the fact that when we do endoscopic sinus surgery and we open up those sinuses and remove tissue, there tends to be a lot more bleeding, and because of that there tends to be the need for packing placement, versus balloon sinus dilation, where you're not really removing tissue, you're just moving tissues permanently around to create bigger openings. It alleviates the need for any packing placement. And it's really, a lot of times it's the packing placement that tends to cause a lot of the discomfort after an endoscopic operation. So we sort of eliminated that with balloon sinus dilation, and so people not only can usually return to work the next day, but they might feel like they have a cold, but they're not requiring any specific pain medications other than maybe some Tylenol or some Motrin, versus endoscopic sinus surgery, where many people require narcotics in the post-operative period.
Perfect.
Yeah.
All right, I don't want to keep her waiting, but is there anything else you want to do before we go?
No, I really wanted to focus on sinuses. I mean, we do the thyroid and parathyroid, and you asked me why I went into it, and what I still find incredibly, enjoyable. Like I was at the OR yesterday doing, a total thyroidectomy, and it's great to teach, the residents, and the anatomy is great, but it's really, I mean, I'm fine with the amount I do now, but it's really, I want to get these people in that just don't know that they have a really good option in the office. I'm hoping that.
You don't need anything for nasal polyps or nasal valve collapse or anything like that.
Well, we could keep going. The question is we could even pull you back in after you eat if you wanted to say more. So just making sure I get the basics. So it's up to you though, because really I want to focus on what you see most important. So.
We could talk about nasal valve really quick if you wanted
Sure.
to.
Sure.
Nasal valve collapse is a condition where you're congested because around your nostrils that area collapses when you take a breath in. Nasal valve collapse is easily diagnosed, even by patients can diagnose themselves if they try a Breathe Right nasal strip, and they can breathe a lot better with it. The problem is the Breathe Right strip only works when it's on at night. There are new treatments for nasal valve collapse that are office-based, because traditionally the treatment was an OR surgery involving moving cartilage around, incisions in the nose, and it took approximately 2 hours under general anesthesia. So now we have a treatment called Latera. It's an implant that can be placed in the nostrils under the skin, and it prevents that collapse, much like the Breathe Right strip, but it does it invisibly and all the time. The implant is dissolvable and will last approximately 1.5 to 2 years before going away. But the idea behind it is that as it goes away, there's some inflammation that causes some scarring in there and firms up that area of the nose and the nostrils where it collapses, and you can get more permanent improvement in that problem in spite of the fact that the implant is gone after 2 years.
That's great. You want nasal polyps or anything else you want to talk about?
Nasal polyps are always a difficult problem to treat. Traditionally, when someone comes in with really bad nasal polyps, what we traditionally do is offer them endoscopic sinus surgery in the operating room. One of the problems with nasal polyps are frequently they come back. So you've opened up the sinuses and done a big operation, and now you're telling the patient a year later they have to take them back to the operating room to shave out the polyps. Needless to say, they're less than enthused about that option. The nice thing about nasal polyps are they can be safely and effectively removed in the office. We can anesthetize the polyps with local anesthetic and shave them away, and you don't need to have to go back to the operating room for them. So that's a new treatment that is now office-based, and it really has helped a lot of patients with recurrent polyps who don't want to keep going back to the operating room.
All right. Anything else?
That's the big thing I see,
This was excellent. No, I appreciate it. So useful. Should we grab her, or did you have anything else to do?
If your nose really isn't working for you, in other words, you have a lot of nasal congestion, sinus pressure headaches, or multiple recurrent sinus infections, you may be a good candidate for balloon sinus dilation therapy. If your nose isn't working for you, in other words, you get a lot of nasal congestion, sinus pressure headaches, or recurrent sinus infections, medicine is probably not the best treatment long term. There are simple office-based solutions such as balloon sinus dilation that might be perfect for someone like yourself.